This is Health and Medicine.
As Medicaid beneficiaries shift to managed long-term care, there's a growing need for professional help to navigate the system. That's especially true for those who just missed the threshold for Medicaid coverage. Our health reporter Erin Billups explains.
On a fixed income, it became increasingly more difficult for Helen Rose to pay her ever-increasing rent and medical bills and manage her chronic obstructive pulmonary disease.
It was harder and harder to get to the doctor. I was falling and I didn't know what to do about it. It just very grim.
Ineligible for Medicaid coverage, much of the burden fell on her daughter Sarah's shoulders.
Every day was a crisis, knowing that if I wasn't there to take care of her, she didn't get any care. And I was working 4 jobs and I was paying 2 rents.
They discovered Helen was likely eligible for a Medicaid spend-down, which grants coverage to the elderly and/or disabled with incomes exceeding Medicaid limits if they're spending that excess income on medical bills. But figuring out how to successfully apply was a daunting task.
I got the Medicaid application. It was like written in hieroglyphics. I thought, I have advanced degrees from the finest universities on the planet, and I can't make sense of this.
The Roses eventually found help at the Lenox Hill Neighborhood House, who, along with the New York Lawyers for Public Interest's pro bono attorneys, walked them through joining a pooled supplemental needs trust.
A trust is not only a place to store your wealth for the next generation, but it's to stabilize someone's current situation.
So Rose put her excess income into the trust, which then pays her living expenses. As a result, federal law then allows Medicaid to cover the full bill for her medical care. She was then able to move into an assisted living facility.
I know that my bills are always going to be paid, and Sarah doesn't have to worry.
Sarah is worrying less, relieved, she says, that they were finally able to access the state's robust Medicaid safety net.
You get to a point where the cost of your care is so much more expensive than anything you could have planned for. Getting old is the crisis.
The program has helped about 100 people going through the same crisis, but they need more lawyers to volunteer to address the growing need.
This is not just a place for very high-income people. Being a part of volunteerism and helping people stay in their homes who are low and moderate income means that this is a richer city.
Erin Billups, New York 1.